Laparoscopy, surgical, colectomy, partial, with anastomosis, with coloproctostomy, low pelvic anastomosis, with colostomy. The distal segment of diseased colon and/or rectal tissue is resected and the new ends are brought together, and an anastomosis is done between the colon and the rectum low in the pelvis with staples or sutures, coloproctostomy. Laparoscopy, surgical, colectomy, total, abdominal, without proctectomy, with ileostomy or ileoproctostomy. After the colon has been mobilized, the colorectal junction and the terminal ileum are divided. The whole colon is removed. The terminal ileum is approximated to the rectum and the ends anastomosed together, or it is brought out through a separate incision on the abdominal wall and sutured as an illeostomy artificial opening onto the skin. Laparoscopy, surgical, colectomy, total, abdominal, with proctectomy, with ilioanal anastomosis, creation of ileal reservoir, S or J, with loop illeostomy, includes rectal mucosectomy, when performed. After the colon and rectum have been mobilized, they are removed. The mucosa of the remaining distal rectum may be stripped. The terminal ileum is folded upon itself and approximated in order to form a pouch, and the terminal ileum is pulled through the remaining muscular tube of the rectum and approximated to the anus with sutures. A loop of ileum above the newly sutured ileoanal anastomosis is brought out through a separate incision in the abdominal wall and fixed there, so the ileum will empty through this artificial opening in the skin as an ileostomy, usually temporary, to divert the fecal stream while the anastomosis heals. Laparoscopy, surgical, colectomy, total, abdominal, with proctectomy, with ileostomy. After the colon and rectum have been mobilized, they are removed. The terminal ileum is brought out through a separate incision on the abdominal wall and sutured as an ileostomy artificial opening onto the skin. Laparoscopy, surgical, closure of enterostomy, large or small intestine, with resection and anastomosis. The physician takes down, closes, a previously created enterostomy, stoma, of the large or small intestine using a laparoscope. The stoma is mobilized and taken down from the abdominal wall. The stoma is resected and the bowel ends are reproximate with staples or sutures. Laparoscopy, surgical, enterolysis, freeing of intestinal adhesion. The physician performs laparoscopic enterolysis to free intestinal adhesions. The physician places a laparoscope through the umbilical incision and additional trocars are placed into the abdomen. Intestinal adhesions are identified and instruments are passed through to dissect and remove the adhesions. Laparoscopy, surgical, jejunostomy, e.g., for decompression or feeding. The physician constructs a jejunostomy using a laparoscope. The physician identifies the jejunum and resects it, rerouting it to an opening created in the skin. An ostomy is created in the skin. The trocars are removed and the incisions are closed with sutures. Laparoscopy, surgical, ileostomy or jejunostomy, non-tube. The physician constructs a non-tube ileostomy or jejunostomy using a laparoscope. Next, the selected segment of jejunum or ileum is isolated. A loop or end of the selected segment of bowel is located and grasped. The skin and fat are excised, the fascia is opened, and the loop is exteriorized through a previously defined ileostomy or jejunostomy site. The laparoscope is removed, the ports are closed with incisions, and the stoma is matured.